Dear friends, I am Dr. Bose. I am a senior consultant pulmonologist, the founder of SANS Foundation. In my 2 decades of pulmonology experience says that the field of pulmonology, which has gone leaps and bounds in last decade or so, especially after COVID times, and it has got so many verticals. It has pulmonology, it has allergy, it has critical care, it has got sleep, rehabilitation, home care. So it's a need of the hour that we have to think pulmonology in a different angle. It is very interdisciplinary. It has got very relevance in with cardiology, internal medicine, anesthesia, even oncology, because most of the brunt of attack in oncological disorder comes to the lung. So the next generation pulmonologist should be very well versed with the different components of pulmonology. And to really understand the components of pulmonology, a good background of internal medicine is required. So my dear friends, if you are a young pulmonologist or a physician aspiring to become a good respiratory care practitioner, you have to develop the skill to understand these core pulmonological areas with focusing on these verticals which I mentioned. So we thought that if you really want to take the pulmonology in the next level, it's very important that we skill people on different areas and based on patient-centric, interactive, algorithms, so that the clinical pulmonology becomes a very unique and very effective. Because 80% of the clinical pulmonology is an outpatient basis. So a young physician should know what to communicate, and in that communication process, it's a two-way connect. He should understand the history because history plays a very important role. So with this background of experience in pulmonology in last 2 decades, then COVID came, and COVID really put a huge load on pulmonologists, and we have seen most of the brunt on the lungs. So the post-COVID area, it's our moral responsibility as a senior pulmonologist to develop an ecosystem so that we can talk about these different components of pulmonology in a very simple way. And that gave birth to this CiCM. In fact, CiCM was started in 2019 with involving the best of pulmonologists across the India. And in the COVID time, we have been doing regular webinars and small workshops and all. But now we are coming with the second chapter of CiCM with the whole concept that if we can build a continuity in patient care services. So CiCM, the clinics in chest medicine in India, was started in association with Forts and SANS Foundation in 2019, and since then it has gone leaps and bounds. So now we are coming up with this website where it will be catering to the respiratory care practitioner. It's very practical, algorithm-based, image-based, interactive. Even the podcast will talk about the patient interactive sessions. So dear friends, if you go through this website, you will find the CiCM India website. It's very patient-centric, it's very simple, which is very innovative. And at the same time, focusing on the patient communications, the two-way communications. We are talking about interactive sessions and a lot of videos, simple videos, which you can enhance your practice. And what we want to do in CiCM is that we want to do hands-on CMEs at different parts of India, and so that everybody gets connected. They get that you have the young pulmonologists have the stakeholdership. It's a very democratic platform, keeping the whole philosophy of pulmonology in mind, very patient-centric and very hands-on, and with the aim to connect all the pulmonologists in India in a very very holistic manner, and giving the concept of treating the disease as a whole, WHOLE, not as a simple HOLE in the body. So it's a very holistic approach to the patient care, and at the same time very practical. And we have used a lot of image-based education methods so that in your busy practice with the effective time, you can do your best for the patients. So we will be coming with a lot of new things in pulmonology, small workshops, small seminars, so that it can enhance your pulmonology practice and you can stay connected with us. So if you have any queries, young pulmonologists or the friends or any kind of or related specialities who are into respiratory care practitioners, whether you're physicians or intensivists or pediatricians or pulmonologists or chest physicians, whosoever is doing, even therapist, please feel to text me or call me, and we will involve you, and we will take it to the next level. Thank you and have a great day. Regards, Dr. Bose, the founder of Clinics in Chase Medicine India.